Now we're joined live via Skype again with Dr. Dana Hawkinson, University of Kansas Health System. Doctor, we asked our viewers on Twitter and on social media to send in their questions surrounding coronavirus, and we got some good ones. Boyd sent one in to me. He wanted to know, what's the biggest falsehood right now surrounding coronavirus?
Oh man, there's a lot. Maybe the face masks offering protection. Again, I think it can offer a false sense of security. I think our message has been clear. Continue to wash your hands. Continue to not touch your face. I think drugs and therapeutics, there's a lot of talk about the hydroxychloroquine and the azithromycin. We are trialing those in a very regimented manner here at the health system because we still don't know the full safety and efficacy of those for treatment of COVID. And certainly they have not been FDA approved. So I think there's a lot as far as that goes, yeah.
Absolutely. A second question comes from David, Dr. Hawkinson. He asks, will this virus be back in the fall?
Yeah, that's a great question. Initially we thought that this probably would be back. There was other concerns, well, maybe it is seasonal like influenza. Unfortunately now it seems like the southern hemisphere is getting coronavirus or more cases reported. So that is the major concern, that in the fall it will come back. It will be a seasonal thing. It's still too early to tell, but that is one of our fears for sure, that it is more of a seasonal thing. If we are able to temper it down, if we can do the measures right now to stop the spread, there is a concern that maybe in the fall and winter it may be back.
It's something I think most of us can't even wrap our heads around, is getting past this once and coming back a few months from now. That's a scary, scary thought. One more question we got on our website, Doctor, that we think is really interesting. Allergies. Does having allergies amplify the effects of coronavirus? So many people are seasonal allergy sufferers. This time of year is just the worst time of year for them because of those allergies. Does it make it worse for potential COVID-19?
It is. I don't think there's any data to suggest it makes it worse. Certainly the symptoms are a little bit different. Mostly with allergies, you're looking at cough, sneezing, stuffy nose, things like that. You're not really getting that with coronavirus. That could just be one thing on top of feeling even more poor if you do get coronavirus. Again, typically for coronavirus, we're looking at more of the fever, the malaise, which is overall just feeling bad, the muscle aches, some sore throat possibly, and of course cough, which you can have with allergies, but it's in the context of the other symptoms for COVID and really not the symptoms of allergies that I had kind of just described.
I think that's a relief for a lot of people to know that they aren't necessarily hand in hand with one another. Doctor, thank you so much for your time this morning, both times spending some time with us this morning